Welcome to Startup Health TV. I'm Logan Plaster. Today on the show, my guest is Bill Nordmark, CEO of Aver, a company that's been with Startup Health since 2013 and which recently raised a $27 million Series C. Bill and his team at Aver are helping companies to do the tough back-end technical work required to transition from fee-for-service business models to value-based care models. In other words, instead of consumers and insurance companies paying for care and procedures regardless of their effectiveness, Aver helps to pull together that care into payment bundles that really connects positive outcomes with revenue. The idea is that by aligning the financial incentives with positive outcomes, we can hopefully raise the quality of care while cutting costs. I caught up with Bill about their moves in 2020 and where he hopes to go in the new year. Hope you enjoy. All right, Bill Nordmark, CEO of Aver. Great to have you with us, and appreciate you taking some time to fill me in on what you've been building. So welcome this morning.
So thanks for having me, Logan. Appreciate it.
So last time we talked, it felt like a world away. 10, 11 months ago, we were at the JP Morgan week at the Startup Health Festival, and we talked about your big news. You'd had a $27 million Series C raise in order to, what I recall was you were really simplifying the process of moving to value-based business models in healthcare. And you were really helping to design and implement and administer payment bundles, just make value-based care easier. So I'd love for you to just start by giving me an update on kind of how that process is going. Is that still a good explanation of the Aver product, et cetera?
Absolutely. Well, thank you for the time, Logan. And our moonshot, which you described so well, we're going to put you on the sales road with us. Our moonshot, which you described, is now more relevant than ever. Obviously, we've been dealt difficult cards like everybody else with COVID. But one of the things that COVID has accelerated is the need for value-based care. And it's also accelerated the concepts around fee for quality and driving, efficiencies in the healthcare industry. So, we have found that during the pandemic, obviously there have been slowdowns and challenges. Everybody's gone to work from home. The healthcare community on the provider side has been impacted by the influx of folks into the hospital setting from COVID. But at the end of the day, many of the projects that the payers were undertaking have accelerated to come out of this COVID pandemic period with a renewed focus on value-based care, specifically to improve the quality of care at a lower cost.
Yeah.
And the costs are increasing, and with folks out of work and the socioeconomic challenges that are taking place, providing better costs at a better care at a lower cost is remains significantly important.
Now, throughout this interview, we'll talk a bit about this move from fee-for-service to value-based care. I wonder if you would just step back for a moment and speak for a second to a viewer who is not in the industry and needs a quick primer on what value-based care is, kind of where we are in the process, and maybe give a real-world example.
Yeah, so I think it easily described by when you and I did an article not long ago with the analogy we shared in your article that you wrote around the airplane analogy, right? Which is, if you have a healthcare experience today, and let's say you go get your knee replaced, you have no idea what it costs. And you get, 15 bills after you've had your knee replaced. And as you eloquently wrote in your article, you pay for the snacks. If it was an airplane scenario, you'd pay for the snacks, you'd pay for the bag, you'd pay for your seat, you'd pay for all these crazy things. And then you get this random airport usage fee, that's $10,000, let's say. And so, folks are really disillusioned with the increase in the price and the increase in the cost, and just the lack of consumer aspects to what they're doing, what they're buying, and what they're paying for. And so what we've been able to do with our prospective episodes is to take that horrible consumer experience that's got tons of cost to it and a lot of uncertainty, and we're moving that to an upfront payment where the consumer knows the price. They know that their knee replacement is going to be, say as an example, $25,000, and they're going to pay no more, no less. And so there's price transparency, but everybody from the specialist to the health system to the payer is aligned on getting a better outcome at a lower cost with a consumer, dynamic. And so we've seen huge value points. We're saving payers and providers and patients somewhere around 15 to 20% in medical cost.
How are you
while streamlining?
How are you doing that? Because it makes sense that this would be really attractive to a patient who wants transparency, but obviously my mind goes to the hospital or the payer that wants to have that bill be bigger. So how is it that you're helping them out?
Yeah, so three main things. Number one, it's aligning the care team to work together at a reduced cost and a more efficient process. So you actually have physicians and organizations making more dollars by streamlining the cost. So think about reducing PT visits, getting more out of a smaller number of PT visits, et cetera. So you have this concept of the downstream care team that, is optimized for output. The second piece is just the dynamics of, changing the site of service. Not all procedures need to be done in a hospital. If I have a 55-year-old marathon runner that wore out their knees running marathons, has perfect body fat, perfect blood pressure, no hypertension, no AMI, none of this, why are they going to a hospital setting, when they could have, knee replacement in a surgical center? Conversely, if I'm, 55-year-old couch potato, wore out my knees because my BMI is super high, I got AMI, hypertension, then I need a hospital setting for my procedure. So you start to really align, the risk of the patient with the setting that can be significantly cheaper. And then finally, you put the patient at the center of some shopping, right? So patients don't have the ability in normal fee-for-service today to see the cost and make a choice of a center of excellence episode bundle provider that's going to give me a price versus a traditional fee-for-service that I really don't know what it costs. So we're accomplishing all three of those, helping our payers design these programs, implement them, and administer them.
Correct me if I'm wrong, but there's a incredible complexity to this. It's one of these situations that can sound like a win-win-win, but the devil's in the details in terms of how you actually roll it out. How do you bundle? What do the bundles look like? How do you administer them? I'm guessing that's kind of part of the secret sauce of Aver. You've got to have a company that can just be that expert at administration. Is that correct?
Absolutely. So we talked back in January at JP Morgan. One of the fundamental things that sets Aver apart is we're meeting the stakeholders in healthcare where they're at today. So many folks think that you're going to be able to go into a health plan and change their business process, and make them do things they're not doing today. Well, it just doesn't work that way. They don't adopt technology that fast. So we talked about being this bridge application to unlocking their systems. And so there's really three things that are very important. Is number one, that tenet of they've got these core systems, let's unlock them with our technology. But the second piece is, you've got to change the reimbursement model. You've got to change from the inside out how these programs are paid for, and the structure of the network. So we meet them where they are technology wise. We then come in and redesign the reimbursement model to meet the outcomes. And then the third piece is, once I've got the technology and I've redone the program, then I got to administer it. And so we've got a turnkey application that allows them ongoing administration at scale. And we've been very, very happy with the success some of our clients have had to reach their goals and potential.
Speaking of clients, how receptive has the market been to this idea, this move in 2020? Who are some of those major partners?
So we've got about 6 Blue Cross Blue Shield plans today. We do work with Blue Cross North Carolina. UPMC Health Plan has been a big, long-time customer of ours. I think we had some recent calls in the past 48 hours with payers, and the reality of the situation is all of them know this is coming. CMS through CMMI has mandated BPCI, which is the CMS bundle program, by 2024. Mm-hmm. So this episode model is going to be taking significant foothold. So payers are kind of now in a mode where they know this is coming. They're over, or at least they're not over, but they've been able to figure out a way to deal with the COVID pandemic where they can start from an IT perspective, focusing on, the next priorities. And we're seeing a significant push towards enabling value-based care. One of the other things that I think was a big challenge was in the pandemic. It's the first time at least in my knowledge, elective procedures were shut down in healthcare. So if you think about, we think healthcare is recession-proof, and here we are, so many providers were sitting on the sidelines. And the only models and only providers that really did okay during the pandemic were those that were capitated because they kind of maintained some level of money coming in. But if you were a fee-for-service specialist, there were no procedures to do. So you weren't making any money. And so we're going to see a change, learned from this pandemic that, this just pay for volume isn't going to work long term. And so we see an acceleration. 2021 is going to be a big year for people catching up on projects, but also evolving their models.
Can you put the numbers in scale? You said 6 or 7 Blue Cross plans. I know those are large. Can you give me a sense of kind of how many lives you're sort of working with now and kind of where you're heading?
Absolutely. So we're touching probably about 40 million members across the country today. Okay. We see that growing pretty significantly in the 2021. We're also looking at starting to work with some health systems. The direct to employer market is a new opportunity for us. There's a lot of health systems that have connection points to large self-funded employers that want to rethink models. So 40 million members today. We hope will translate into hopefully near double that in 2021, by the end of 2021. And so we're somewhere around we touch from an analytics perspective about 97 to 100 different episodes in process. We probably have 10 to 12 that we're analyzing for customers. So we're starting to reach some serious scale, helping payers and providers with these value-based programs.
This is a bit under the hood, but you describe this as a bridge technology. You're working with these payers, these insurers that need to comply with bundled payments, but the administration is technical and challenging. What is it that makes it so difficult that the payer themselves don't just figure it out and just run bundled payments? Why is it necessary for a bridge technology?
Well, look, if you think about any major or company out there, and you think about banks, right? Think about all the systems that banks run. Payers are no different. These core admin systems, claim systems that payer run are extremely sophisticated, extremely large, extremely expensive pieces of technology. Some have been cobbled together through acquisitions. Some are, versions old. And in some cases, payers have 4 or 5 instances of these systems, right? So the IT lift of managing these systems is not insignificant. Couple that with, the mandates that payers have. if you're a payer IT leader, there's probably 20 to 40% of your annual IT budget is spent on projects that are government led, right? I mean, they're projects that have to be done for federal, state mandates,
Got it.
stuff like that. So if you think about it, and I'm just throwing this out there, but I mean, if you think about it, every IT staff out there is tapped out, right? I mean, their lack of resources.
Yeah.
For them to undertake a project that is going to, innovate these core systems is not an insignificant lift, both resource and dollars wise. So we came in with a system that, met them technology wise where they were and said, you don't have to go through and redo, processes and projects that you've had for a long time. Let us just plug into existing components you have, and then let's create this unlocking of these systems so they'll start talking and have interoperability to other organizations. And then we'll layer on top of it the value-based program. And, it's music to the ears of some of these IT organizations that say, hey, I mean, we won't get to where we need to go. We were on a call yesterday with a Blue Cross Blue Shield plan where, they in 3 to 4 years want to be doing this. They won't get there even in 3 to 4 years if they don't have a technology mechanism that unlocks their systems that they have today.
Got it. If they partner with you, will it still take 4 years, or will there be?
It will not. They look. I mean, implementations are not insignificant work, right? I mean, from an analytics perspective, we can get payers up and running pretty quickly. Our standard implementation is 6 to 9 months. So, you got to do the work.
Time.
It takes time, and these are very nuanced programs. But even the organizations that have implemented with us, their speed to market post implementation is, exponentially faster than I'll get to this in 4 years and then pray that it's another 2 years on top of that, right? So, yeah. And by the way, the plight of, I would assume the plight of a CIO or CTO at a payer is, my top 3 projects normally become top 1 because I had to drop, 2 of the 3 for another process or another project that popped up, and they're always playing catch up. So we're here to support them on that front, yeah. But we're also here to support the payer provider relationship and ultimately the consumer at the end of the day.
You touched on this briefly before, but how have those conversations changed in a post-COVID world, or as we see the light at the end of the tunnel? Are those conversations significantly different with payers?
Well, the interaction of going to Zoom for all these conversations is drastically different, right? I mean, I think the healthcare community has probably been upended more than most. Be payers, specifically payers in hospitals, obviously, but I mean, they're in the office, all the time, little work from home. These are complex meetings, yeah. Big groups that have to come together, different business units, departments. And so, if you think a payer's got a couple thousand employees, 5,000 employees, and you send everybody home, there's a disruption of them getting their legs underneath them and getting on Zoom calls and stuff. So, it has been a challenge just like everybody else, but I think there's been a lot of streamlining that's started to happen and a lot of good conversations. I find that meetings get more to the point because people don't want to be on the Zoom call for 2 hours. And, so you get more to the point, you get your business done, and then you jump off. And so, but we see the light at the end of the tunnel. I mean, most folks hoping for the vaccine, as we kicked off when we were chatting, hopefully we have a vaccine. Hopefully we start getting some normalcy by next summer. And we're anxious to see our customers, because there is a dynamic of just personal interaction that you lose over the laptop.
Especially when you're talking about a 6 to 9 month implementation, I'm sure there's trust that's built. Yep. Those relationships matter when it comes to good communication, et cetera.
No doubt. And, fortunately, we've had a long-standing relationship with all our customers. So our team knows a lot of folks, and there's that initial trust built. Building trust with the new customers, is we're excited to meet them in person. I think like some people out there, we've had people that we've hired, we haven't met them. I
Yeah.
mean, we've done all the interviewing over Zoom, and we're hoping to meet them at some point in person, right? So customer interactions are no different.
Your comment about hiring, leads me to, I think, is my final question, which is a little bit of a departure. But last May, you were named, congratulations, one of the top 50 healthcare technology CEOs of 2020 by the by Health Technology Report. And I'm just wondering how you would describe your leadership style. What kind of CEO are you?
Well, there's a pre-COVID type CEO, right? And then there's the during the pandemic type individual. I've always tried to be down to earth and leading the team and being on the front lines. I think during the pandemic, one of the things that I've learned, and I've actually incorporated this into my my style is, everybody is challenged. Everybody is dealing with a lot on their plate.
Mm-hmm.
And the being real dynamic. I have a wife and two kids. I have a 7-year-old son and a 5-year-old son. And, I'm dealing with the same challenges that my staff is dealing with, whether it's, dog barking when the UPS person comes to the door, or it's Zoom calls with kids and schooling and all this type of stuff. And so I think authentic leadership, I think people understanding that, we're all in this together, and being real. It's not a shiny perch that you're sitting up on top of, and you got to be real. You got to be with the staff. I think one of the things I miss most has been, I'm a big lead by walking around, talk to people, have that pulse of checking in with folks. And it's hard to do that over Zoom.
How big's your team?
We're 35 employees or so.
Okay.
So
And initially located in Ohio.
So Columbus, Ohio is our headquarters. And, I think we've really changed our mindset of, obviously what this pandemic has taught us is you can work remote pretty much anywhere. Right. Mm-hmm. And so we're finding the best talent all over. Columbus is still our home and where we're building. But, we want to find the best talent that wants to do really cool stuff and meet our moonshot forever.
What's your piece of advice for a CEO, just given this recognition that you received, who's earlier in the journey, maybe is struggling with being real with a team? When you're just starting out and you're building your team, you can often feel like you have to assert your leadership, assert yourself more. What kind of advice would you give to a younger CEO in their process about kind of cultivating that skill?
Remain authentic, leverage high integrity, and, meet people where they are. I think the biggest challenge that we're having right now is there's a lot on everybody's plate. There's a lot of uncertainty. There's racial tensions, there's socioeconomic tensions, and people want a calming influence. People want somebody that can provide hope. They want somebody that's going to be real. They want somebody that's going to share, not BS with them and not, fake it. And that they know that they're dealing with the same challenges they are. And, but have a strict focus on, we're going to get through this. We're going to be okay. It's not going to be easy, and I think one of the things that I've learned recently in our team is focusing on, don't be optimistic, don't be pessimistic, but be realistic. And if you stick with that realistic view, there's going to be good days, there's going to be tough days, there's going to be bad days. And as long as your team knows that you're in the fight with them, then they're gonna follow for you, and
Yeah.
you'll do the same for them.
It's good advice. Good advice. What I'm hearing is positive realism. We're going to get through this, but we're going to be real about it.
Well, look, and if you're a young entrepreneur or CEO, I find there's a lot more bad news than good news sometimes. And if you don't figure out a way to turn that bad news into more drive to keep the moonshot focus, and don't be discarding of bad information. I mean, there's some bad information. The last thing I'll leave you with, one of the things that we've realized during this pandemic is that it accelerated our organization's soft underbellies. And we've taken those soft underbellies and realized, hey, we need to make some tweaks. And so bad news or negative news provided a lot of positive opportunity for us and silver lining in the pandemic.
Good stuff. All right, Bill, thank you for taking the time with me today. Congrats on the growth of Aver in 2020, and I'm excited to see where you take it in 2021 as you really help value-based business models come to fruition. So thank you, Bill.
We appreciate it. Thanks so much.